It's a really unique network which include 27 countries from the 3 different regions, 3 different cultures. But the political not influence is on this networking. The people have built big trust, informal exchange on information, work together, learn together.
The EpiSouth Plus project contributed to the control of public health threats and other biosecurity risks in the Mediterranean region and Southeast Europe by focusing on 4 areas of intervention. The establishment of a Mediterranean regional laboratory network to facilitate common threat detection, the promotion of common procedures for generic preparedness and risk management, the development of a Mediterranean early warning and epidemic intelligence system, and the support of IHR implementation.
Le réseau de laboratoires est très important et très crucial pour faire la veille sanitaire d'une manière correcte. Ça permet d'améliorer les compétences, d'avoir plus de matériel pour les laboratoires de référence et c'est un appui important pour la veille sanitaire.
We could make some standardization between the laboratories, we could have the same terminology, even it is very important. For example, for some commercial kits or something like that, in my laboratory, the simplest example, I changed the kits that I used until now after the EpiSouth lab training.
Building on the experience developed during the first EpiSouth project, EpiSouth Plus also aimed to enhance and strengthen preparedness to common health threats. Following a set of training modules and workshops, the capacity building process culminated in the implementation of the Nautilus simulation exercise and the preparation of the Emergency Preparedness Planning (EPREP) tool. The EPREP tool was aimed at supporting EpiSouth countries in developing national generic preparedness planning.
Also, all the trainings and all the capacity building that was done during the EpiSouth project is something that will stay long after the EpiSouth itself. And also, I would like to stress the significance of the simulation exercise that was held in October 2013, because it was the unique opportunity for Montenegro to gather our national experts from different areas. And basically, that was the first time that we had the opportunity to sit along with Ministry of Internal Affairs, Office for Civil Protection, Ministry of Health, Sanitary Inspection, Institute of Public Health, and that was probably one of the most important added values of EpiSouth.
Enhancing early warning in the Mediterranean is essential to reinforce health security in the area. In order to facilitate information sharing, the EpiSouth network set up and facilitated a dedicated secure platform since late 2012 to ensure its sustainability and interoperability. This secure platform is hosted and managed by the European Centre for Disease Prevention and Control, ECDC.
The pandemic flu, when EpiSouth provide us daily the situation of pandemic flu cases, not only in EU countries but non-EU countries, which is very important for us because we know at every moment what is the situation almost all over the world.
In order to increase health security in the Mediterranean area, it is necessary to enhance preparedness, detection and response capacity at national, regional levels to face threats to public health. The framework of the International Health Regulations, IHR, is particularly useful to this effect because it is not only legally binding for all EpiSouth partners, but it also declines a set of capacities to be met, detailing a mechanism for information exchange and response collaboration under the umbrella of WHO. EpiSouth Plus contributed to the development of knowledge in this area by conducting in 4 countries of the network the EpiSouth Plus National Situation Analysis on Coordination of Surveillance between Points of Entry and National Health Systems, also known as the ENSA.
And one thing EpiSouth did was, during the situational analysis, it gave us the opportunity to explain ourselves. I mean, I had to meet with my colleagues at the management of the air and seaports and explain what we do on a personal level. And I think this has enhanced our relationship, our working relationship after then. I mean, we communicate more freely, and I guess we understand each other more.
As my role as project officer of EpiSouth, I think I would say I learn a lot. One of the things that maybe you don't realize is that for us is the first time as well that we work so many EU organizations in the same project. That means for me it was very beneficial to learn to work with ECDC on specific issues related to EpiSouth, because it was not only on epidemiologic intelligence but as well on the laboratory component we worked together. On the training, because as well MedEpiet became a reality during the EpiSouth existence. And I would say that for me the major, result is EPREP, the tool that has been developed by EpiSouth, because I think it's quite good technically speaking, and I think this is in a very useful moment for us, because this is in line with the implementation of the Health Security Initiative, because we would like to support all the member states to develop generic preparedness planning, and this is worldwide, because this is in line as well with international health regulation.
When speaking about EpiSouth, I must admit that we were a little bit skeptical at the beginning, because trying to put together representatives of more than 20 countries is not so easy, and from 3 different regions in WHO at the time seemed impossible, but now we see that it's possible. 7 years after, EpiSouth turned out to be more than just a network of professionals. It became a network of friends and colleagues, achieving a level of trust and cooperation that will be very hard to reach by any other network or project in due time. We are on the end of the project, but we are really start to doing something good, and I think we had to find a way to continue this process.